Nursing Assessment in the Elderly by Robin Clarkson at the University of Charleston. The elderly in our society are a unique group of individuals with special needs as well as special health-related issues. In an assessment of this population, Faye Abdallah's nursing problem list works well. Let's examine some of the issues and address how to help this group. The needs of the elderly in this format show what I believe are most important. In the state of West Virginia, the group of individuals aged 65 and older make up over 15% of the total population. Because of this large number, we see a need to view them not only as individuals, but as a group of people with similar needs. According to an article by the Pasadena Health Center, people are living longer than ever, and about 80% of older adults have at least one chronic disease, and 77% have at least two. Faye Abdallah was a nurse who was ahead of her time regarding the nursing profession. She believed that nursing care should be based on research, not hours of care, quote unquote. This was a new approach to the profession of nursing and sounds very similar to our idea of evidence-based practice in medicine. She theorized that nursing care should be centered around the patient and not the disease. Nursing problem number 1. Recognize the physiologic responses of the body to disease conditions, pathologic, physiologic, and compensatory. The base of the pyramid shows physical needs and health-related needs. Faye Abdallah's 21 problem list can be subdivided into 3 categories: physical, social, and emotional. The physical needs of any patient will have to be addressed before we can progress to other needs, such as social and emotional. All needs make up the complete patient profile, but what good would come of us addressing social needs if the patient is starving? Some of the physical needs of this group are food, water, rest, and medications as necessary. Nursing problem 2. To promote the development of productive interpersonal relationships. Support is a big issue with this group of people. The physical needs of the elderly are most important in their care, but we also need to be aware of other needs. One such need is the elderly person's support system. Do they have family members to help in their care? Do they have friends they can rely on? As caregivers, we need to be aware that many of their friends and family members may already be deceased. Nursing problems 3 and 4. To facilitate progress toward achievement and personal spiritual goals, and to facilitate awareness of self as an individual with varying physical, emotional, and developmental needs. Faye Abdallah. Ethical and spiritual needs. Another assessment that should be made in this population is how do they want things to go at the end of their lives? Do they have a medical power of attorney or living will in place? Does someone close to them have access to these documents? According to the Elder Care Alliance, there are positive cognitive benefits that come from spirituality, and it helps build a sense of belonging when we spend time with others of our faith. Nursing problem 5. Abdallah wrote, to create or maintain a therapeutic environment. According to dictionary.com, contentment is the state of being satisfied. Being content has a lot to do with how well a person is, both physically and emotionally. In conclusion, there are many elements that factor into the health assessment needs of the elderly. Due to the increase in numbers in this particular group, we need to be aware and ready to not only assess their needs, but also provide them with the best nursing care.